talking a lot about something that really, relates, because, Lauren's telling the story of prescription drugs, and, kids don't start with things like heroin or fentanyl. And this is one of the, what we think of as a gateway to those things.
What does electronic cigarettes mean? What is the data on them now? Because they're really an emerging product, but we have enough to know that they are not safe, and they are definitely not safe for our kids. Electronic cigarettes and vape, we're talking really about the same thing, and we're going to go over that in a little bit more detail. But what you see here is a picture that ranges from the second to the top is a conventional cigarette. And you can see this big range of assortment from an e-cigar to what is sort of more thought of as a tank system at the bottom. But this is what our youth are really looking at and using. And so I have a JUUL, and Abby has been very kind to bring a lot of samples as well. And JUUL, and we'll talk about a little bit more, is right now got the majority of the market share. What you see on the top right is JUUL products, but they have a JUUL skin. You can buy this online, you can personalize your JUUL. There's something called Soren, SMPO. Who's seen some of these products? I know some of our educators have definitely, but I think and one of the things that really I feel very passionate about is that the people that I talk to, now you're the experts. I want to train the trainers. So when you go out and you talk to your friends or you talk to fellow colleagues, it's really important to get this message across, because parents find some of these products in their kids' backpacks or pockets or sock drawer, and they don't know what they are. And so you guys are now the experts. And so JUUL in particular, there's some, you can see some of the advertising that they have used, which is very similar to what Big Tobacco has used in terms of thinking about this is sexy models, mainly young, white, and using these products with clearly a health message, that this is healthy. But JUUL was 72% of the market share. As of last quarter. We think, unfortunately, we're going to be seeing more and more of this product. And JUUL is what we call a pod system. So anybody seen these pods or these tops? I think before I really knew about JUUL, you see some of these tops everywhere, and you think, what are those? It's a kind of disaster in terms of plastic and recycling. But basically, the pod goes into the product, and then you can, charge it with just a regular USB. And I'm going to pass some of these around so you can really just take a look and see also some of the marketing. We call these the iPhones of smartphones. They just have a very innovative design. As you can tell, they look like a USB. They really are very deceptive. And I don't think that is any type of accident. So JUUL was actually started by 2 Stanford graduate students, and it's hard to know what their ultimate goal was. They say that it's because they were smokers and they were trying to give smokers an alternative to quit. We'll talk about how that unfortunately is not what we're seeing. But whatever they started with, unfortunately, they have sold out. Altria, which is also known as Philip Morris, purchased a 3rd stake. That doesn't even count what they paid the JUUL staff for $12.8 billion with a B. So you know that we're talking about big money, and anytime big money is involved, unfortunately, what we're seeing is our kids are the ones that are really being targeted. And so we'll talk about that a little bit. Even though there's so many different products, I think it's important for all of us to know that really the parts of the electronic cigarette are very similar. Can you see this here? No. But, so there's a mouthpiece, and then basically there's a battery. And have any of you guys heard some of the media stuff about batteries exploding? There was somebody who died, probably in the last few months. So unfortunately, little to no regulation. And so the battery, what it does is it takes the liquid and it heats it up, and basically it forms what's really an aerosol, but what a lot of people call a vapor. And the reason that's important to distinguish is that, you know, the vapor, you kind of think of water vapor, harmless, and I know that there's a lot of marking to that. The aerosol is really these ultrafine particles, and those ultrafine particles get very deep into the lungs, and what we're seeing, unfortunately, is that those ultrafine particles can cause lung irritation, lung damage, and also lead to some of the same, unfortunately, health effects that we're seeing with cigarettes. I did forget to mention, but we're going to go through, that part of the concern with these pod systems is that they, number one, they all contain nicotine. So I know frequently at events like this where there's parents, they say, oh, well, my son told me there was no nicotine in this. And as those JUUL boxes go around, you can see that it is very hard to tell that there's nicotine in these products because there's tiny, you know, like 6-point font that says 5% strength. And then when you really get down into it, you see that it says, you know, this is nicotine. There is no pod system that I'm aware of that is from the manufacturer that is zero nicotine. So basically what's happening is our youth are being exposed to very high levels of nicotine when they're using these products. So just to put that in a little bit of perspective, the JUUL has pods that are 59 milligrams per milliliter. 59 milligrams. And you know, when you take a cigarette and you smoke it, you get about 1 to 2 milligrams total from that cigarette. So you're looking at a huge, you know, a very, very high concentration, you know, between one JUUL pod and, you know, even an entire pack, a 20 pack, you know, 20 cigarettes in a pack. So that makes us very concerned that youth are using these products, they don't even know that there's nicotine, and then they can become addicted very quickly because the amount of nicotine in it. So there are really just 4 main take-home points that I want to get across because we've got these amazing speakers after me. That electronic cigarettes are the most common tobacco product used by youth. That's been the case since 2014. That they contain nicotine, just like I said, and youth are more likely to be addicted. And we're going to hear more about that, about the adolescent brain and what those effects are. We know that youth who use e-cigarettes are more likely to go on to traditional cigarettes. There's lots of good data at this point about that. And then really scary that there's new data that is emerging that looks at cross-sectional populations of adolescents and finds that those adolescents are more likely to be using marijuana, more likely to go on to other drugs of abuse. I don't think any of us are probably surprised about that, right? So you start one product, and of course, using tobacco in Alabama is illegal if you're less than 19 years of age. So, you know, you have somebody who's using a product that's illegal, and then it makes sense that they go on to other products. And we know, again, we have enough information right now to know that e-cigarette use is not safe. It has toxicants and carcinogens, cancer-causing agents, and they have negative impacts on public health. So we'll dive into those a little bit more. So this is from the CDC, the Centers for Disease Control. This came out just this past November, got a lot of media attention. And the reason is that e-cigarette use, which includes JUUL, includes Vape, went up dramatically by 78%. And when you look at some other national surveys, there's something called Monitoring the Future, that increase is the highest increase of any substance that has been recorded in a 1-year period. So we're talking this, you know, historic, horrible increase, and how is that happening to our kids right under our noses? So, you know, thinking about this community and how engaged you guys are in terms of, you know, what's happening at the school level, what's happening at the community level is really important. So I'm so excited to see everybody here. For years and decades, you know, I started getting into this work in about the mid-2000s. You know, tobacco use was dropping among kids, and we were all really excited about it. But unfortunately, with the huge rise in electronic cigarette use, we're seeing total tobacco use rise as well. And so this is kind of a little bit more of a breakdown. I know this is a little bit busy, but on the x-axis on that bottom, you see the different types of tobacco products, and then on the y-axis, there's a percentage. And so what you're basically seeing in the red bar on the left is the fact that, we were seeing tobacco use go down. The black bar is 2018, that shot up, and really it is pretty much all because of electronic cigarette use going up so much. And so, people ask, where do kids get them? This is a picture from a vape shop. This is in Hoover, but I could certainly show you multiple in many parts of Birmingham. And vape shops have gotten a lot of notoriety. I think, reasonably so. But really, most of our kids are getting electronic cigarettes, JUUL, vape, I'm using all those terms interchangeably, from the convenience store, the gas station down the road. And this is a picture of a convenience store gas station very close to a high school. And I know it is a little bit hard to see, but there is JUUL products and JUUL products that are also like knockoff JUUL products that basically our youth have access to. And that's something that I think is important to know, that these products have flavors, and these flavors are very enticing to kids. And so, not only can, oftentimes there's easy access at convenience stores and gas stations. Online is definitely a place where we are concerned about from a public health standpoint. So this is the JUUL website. And there have been some changes to it with age verification, but basically it says you must be at least 21 years of age to purchase products on JUUL. And it says, the top blue says, I am 21 and agree to be age verified. And basically you click on that button and it asks you for your birthday, and then you can get in to buy the JUUL products that you want. It's not that foolproof of a method. And the price point for these is higher than what you might have with a pack of cigarettes. At the start, you can buy a JUUL, just the actual device, for, it's about $40 for a JUUL plus a multi-pack. And then after that, generally you buy them in packs of 4. For, online, it can be $16. So one JUUL pod, people compare to one pack of cigarettes. And in Alabama, unfortunately, we have one of the lowest tobacco taxes in the country. And so a pack of cigarettes, I think the average is about $4.50. And so when you say a pod of the JUUL is about $4, then you're kind of thinking about comparable costs there. So next point is that e-cigarettes, we already know, most often contain nicotine, and the pod systems all contain nicotine. And youth are more likely to be addicted. And so I think, a big learning point is that, these are tobacco products. So this is just a picture of the tobacco plant on the upper left, and then that's cured and dried, and then basically ground up. That's what's in cigarettes, but that's also what's in those e-cigarette liquids, including the pod. So any e-cigarette that contains nicotine or liquid is a tobacco product by definition, and that's important when we think about regulation and how we can protect our kids. So in terms of nicotine addiction, or any addiction, and we've got some big experts coming up, that we know the adolescent brain is very susceptible to addiction. And not only are they susceptible to addiction, but we know that from animal models that when you're exposed to nicotine in the adolescent period, you can have permanent cell damage and changes that can be permanent. So, of course, that makes us very concerned when we're seeing this huge uptake, 1 in 5 of our high school students using electronic cigarettes. And then we've already kind of touched on the gateway theory, that you're more likely to be using other products, and that because your brain chemistry has been changed. So going on to e-cigarettes, being that when you use e-cigarettes, that you're more likely to go on to traditional cigarettes and other substances of abuse. Again, this is something that 5 years ago I wasn't able to say, but we have a lot of data now from multiple different studies that youth who are using e-cigarettes, even if they're, quote, the good kids, the kids who have very low risk factors, they're 4 times more likely to go on to start cigarette smoking. And, cigarettes we know are really the most lethal product known to man. They kill 1 out of every 2 long-term smokers. So absolutely, while e-cigarettes we know are not safe, we don't want them to be going on to cigarette smoking. And then lastly, e-cigarette use, again, not safe. We know that they have negative impacts on public health. And so when we look at e-cigarettes and what is advertised, and I already mentioned that we're in a period of very little regulation. It's not accurate to say there's no regulation because the FDA in 2016 basically passed a deeming rule, which basically means that not in addition to traditional cigarettes, which they got that ability in 2009, they can actually impose some regulations on e-cigarettes as well as cigars. Unfortunately, a lot of those regulations have been postponed till 2022. The FDA right now is looking at fast tracking, making those things happen a little bit earlier in terms of having what is actually on the products really is what is in the products. But right now what we know is that the ingredients that are advertised in e-cigarette solutions generally are humectants. So anybody ever been to a concert with all that stage smoke? That's a lot of those humectants. Humectants are something that are very common. They are in a lot of cosmetics. We know they are safe for ingestion. But in terms of inhalation, those ultrafine particles that we talked about, we really have no long-term data to know. And in fact, we have some data that makes us very concerned about the safety. We know that e-cigarettes, when you look at the packaging, they'll also say that they have flavoring, and we'll talk a little bit about that. And then, like I mentioned, nicotine. So this is a great kiosk. I love showing this because it really shows a lot of the range of things that we are very concerned about with e-cigarettes. So on the top, you kind of see, that there's lots of dessert, candy type flavors, and then, from the top, you see that 0 milligram of nicotine, and that is really a completely inadequate way to characterize. What does 0 milligrams of nicotine mean? It generally means 0 milligrams per milliliter. Because if you go down and you see there's 0 milligrams, 8 milligrams, 12, and 24 milligrams. Now that's the old e-cigarettes. So I already mentioned that JUUL is 59 milligrams per milliliter. So, the traditional what e-cigarettes came out as, we're seeing them keep upping the ante. With what you see here, JUUL is twice as concentrated in terms of the nicotine. So thinking about what is advertised and what's actually in them, we're seeing huge differences. And so, of course, we have found the humectants, which is propylene glycol and vegetable glycerin, that stage smoke that I talked about, the flavoring, nicotine, but unfortunately what we're also seeing is a lot of the same things that we see in tobacco products or in cigarettes. We have some toxicants, carcinogens, tobacco-specific nitrosamines, which we know cause cancer, those ultrafine particles that get really deep in the lungs, like we talked about. We know that the coils, those metal coils that heat up the liquid, degrade, and so we've seen metallic nanoparticles, really just a bunch of stuff that we know is not safe. And so while we don't have enough information at this point to say that electronic cigarettes cause cancer, for example, we know that the intermediate step is there, that it has the same products, the same carcinogens that cause cancer in cigarettes, but we just don't have the 20, 50 years of data to say that this leads to this yet. Now, the problem is that when 1 in 5 of our high school students are using these products, and using them not even experimentally, but using them 20 out of 30 days a month, what we're concerned about is, 20 years from now, when they're in their late 30s and their 40s, we don't want to see this huge rise of cancers and other things. We want to try to, stop it now. And unfortunately, the cat's out of the bag, but you guys, this community has ways that we know are effective that can that can fight this. So we talked about humectants a little bit, just to arm you with other things to know about that propylene glycol and vegetable glycerin. Again, they're generally recognized as safe for ingestion, but when we talk about inhaling, we know that the propylene glycol can lead to respiratory irritation, and then the vegetable glycerin can lead to acrolein production, which is one of the worst carcinogens, one of the worst cancer-causing agents that are out there. And then flavorings, we really don't have any information about flavorings overall. Part of the problem is there's about 15,000 flavors, but we do know some specific ones. Cinnamon, we know can impair immune function. We've known that for a while. Buttery flavors can cause, like what we've seen in popcorn factory workers, is popcorn lung, bronchiolitis obliterans. And one of our largest concerns is flavors are known to appeal to you. So I speak at schools, to high school and middle school, and one of the things that we'll do is we'll get a bag of Sour Patch Kids, and we'll put a pack of cigarettes in there. And we'll basically give this bag of Sour Patch Kids to the kids to say, what's inside this? And they're like, ooh, cigarettes, yuck. Because from a public health perspective, people like Dr. Wilson have done a great job teaching our kids these are not safe. But what's happening is that e-cigarette companies are getting really smart, and they're hiding kind of the health concerns in these fun packages with Sour Patch Kids, with donut flavors. There's 15,000 of these flavors. So it's going to take a really long time for the scientific community to catch up with what is in all of these flavors, but we already know that they're very appealing to kids. And then, just to kind of, make sure to let you guys know from the standpoint of what's harmful for adults and kids, cigarettes, have 7,000 chemicals. We know 70 of them cause cancer, and what we are now learning is that e-cigarettes are having some of the same effects. So for those of you who are kind of nerdy like me, there's a National Academy of Science report. It's hundreds of pages, but there is a summary statement that's maybe 10 pages, and it basically has boiled down a lot of the literature. At this point, it's about a year old, and it's already, there's so much stuff out there that's emerging that's scary about e-cigarettes and what the health effects are. But really quickly, we know that in terms of cardiac effects, so most people think about lung cancer with smoking, but the majority of the deaths are from stroke, heart attack, cardiovascular disease. And what we know about e-cigarettes is that the aerosols can induce endothelial cell dysfunction, which is the same pathophysiology that you're getting a lot of cardiovascular disease. So again, e-cigarettes have the same stuff as cigarettes. We can't say yet that they cause heart attack, but that pathway is there. Same thing with cancer. We know that they can cause DNA damage, but we're not at the point where we can say definitively lung cancer. But we don't want to wait the 20 years and have all our kids addicted before we know that for sure. And then there is definitely enough information for us to say that kids who are using e-cigarettes are more likely to cough and wheeze. We want to definitely make sure that we're protecting our children, particularly with respiratory illnesses such as asthma. So lastly, public health harms. This is a blue advertisement that, this was really big initially, that you can smoke anywhere, even in the places you can't smoke, you can vape. And so there's a lot of potential concerns in the public health field with e-cigarettes and with as many of our youth that are using. And so lastly, I'm just going to finish with, talking about e-cigarettes as a smoking cessation device. And we know that they are not effective. And in fact, with all of these studies, this is a meta-analysis, smokers, when you combine them all together, because there's no perfect study, that smokers who are trying to quit using e-cigarettes are actually less likely to quit. What we're finding is that they become dual users. They're using both the e-cigarette and the cigarette, and unfortunately, we know that the combination of the two can even have worse health effects with some emerging data that's coming out. So definitely want to make sure that this audience knows if you have a friend or you know somebody who's wanting to quit, You should not that you would be necessarily recommending e-cigarettes, but you should encourage them. See your doctor, definitely have your doctor prescribe things that we know work. So that is it. I think I'm on time, and thank you guys so much. I think our next speaker is coming up now, Lauren.